I am very excited to be here for the first of, I hope, of what is many conversations with the Dean. I would like to thank everyone in Alumni Relations and Advancement for giving us the opportunity to speak to everyone, and for all of you for joining us. I think that you will find that we have a very stimulating hour planned for you, and we're excited to tell you a little bit about what's going on in the School of Nursing. We're excited to be here, but as I see on my screen, I think probably the most excited is perhaps Dean, our student who's joining us, counting down those days very quickly before he is a new graduate and transitions to practice. Thank you, Dean, for joining us at a very busy time in your career, and I think you'll appreciate the insights that Dean has to offer. So what I want to give you is a little bit of background about what's going on in the school, and then we will transition and get the experts on the call to hear more about our simulation and our experiential learning. Colleen, if you would advance the slide for me, please. So I've been here for a little over 3 months, and I was amazed during the search process about the collaboration and the leadership here at the University of Rochester School of Nursing. These are just a few of many. We could have filled up the whole hour, really, with some of the great accomplishments going on here. One thing that I do want to highlight as you look at these photos, I think that there is a huge history. There's a very strong history in the College of Nursing from past deans, and a genuine commitment to make sure that the school moves forward in very meaningful ways. You can see my photo with Dr. Lee Ford. That was one of my first visits, and many of you on the call know Lee. She will be turning 102 in a few weeks. And I can tell you from my visit with her, she is still as sharp as a tack, so they say. So we had a very nice visit. Pat Shiverton also stopped in as I made my transition, who was a previous dean of the school, and Dean Emeritus Rideout, Kathy's commitment to make sure that my transition is as seamless as possible has been amazing, and I'm very thankful. You can see that our excellence continues. It's great to be in a school with such foundation, with such a strong foundation. Dr. Susan Blakeman, who is in the bottom center, was just recently inducted into the American Academy of Nursing, which is, really one of the pinnacle achievements for nurses in their career. So congratulations to Susan. You can see in the very top corner, we just had the culminating experience for students that come to us from East High that participate in a Pathways program. They had their poster presentation last night. For those of you that follow us on Twitter, I'm sure that many of you saw that this morning about the end event for the East High students. And you can see that our faculty and our students are just receiving awards, American Heart Association, university awards. So it's a great environment. So as we move forward, Colleen, if you could move ahead. Some of the updates that I would like to give you is some of the great things that are going on and continue to go on. We've received the Apple Distinguished School designation, so congratulations to Dr. Rotundo and her entire team for receiving this designation. It sets us apart from so many other schools. We enrolled our inaugural Pediatric NP Acute Care Advanced Certificate cohort. This really meets the needs of our community. It's a great program. One of the big things we have coming up in our future is our CCNE accreditation. Our self-study is due in early January. Our site visit is April 3rd through the 5th. That will be a 10-year accreditation, and it has really been all hands on deck to make sure that we have a successful accreditation visit. Our NIH research ranking improved to 23 with $5.5 million in external funding. I have to tell you, coming from my former school, that we are able to maintain and improve our ranking with the number of tenured research faculty here is amazing to me. This is a powerhouse. It is a small but mighty powerhouse. And if strategically we're able to recruit additional researchers here, I am quite confident that that number is going to continue to improve. We received the HEED Diversity Award for the 6th consecutive year. That's amazing, really unprecedented as we look at other schools like us. So congratulations to the team and everything that happens here in the School of Nursing on a daily basis that we are able to receive the HEED Award. And our Center for Employee Wellness has the highest number of organizations under contract since inception. So really, all of the core missions of the School of Nursing are really firing on all cylinders. So we have a very exciting future. As we move ahead, we can see some of our student trends. Now, this one isn't as positive as we would like it to be. You can see that in fall 21, we had our highest number of students, which was 796. COVID has had impacts on nursing, not only on nursing workforce, but also on nursing students. And we dropped in fall of 22 to 696 students. And we also have many of those 696 who are also on leave. Students that we had enrolled, but because of work life, family, school balance, have taken a pause in their education. This is one of the challenges that faces us, and we will get through it. Across the board nationally, student enrollment in nursing programs, both undergraduate and graduate, are down. So we're really looking at innovative ways to improve enrollment. And I think, the previous East High reflection is a great one. As we move forward with the next slide, we are in the area beginning strategic planning. The university is in the process of strategic planning, and we are going to follow the university. So it's an exciting time, and it's a great time to be talking to alumni and our community partners and our students and our faculty. This strategic planning is going to come organically from us in the school. We are going to launch this initiative probably in early January. I suspect our priority areas are going to focus on many of these on the screen. And as we move ahead with the next slide, I've highlighted some of the areas I suspect where we are going or will be going. One of the things that we did already initiate strategically was a 2-year APNN program. Doing the APNN program in 12 months is intensive for adult learners. So we have rolled out a 2-year program that will be beginning, and we hope that will help with that work-life family balance. I have a slide on this URMC Nursing Scholars Program, which is exciting. I'll talk about that a bit more in a second. We plan to strategically increase our funding for academic programs through HRSA grants and Department of Labor grants. We are going to continue to grow and codify our Academic Innovation Center of Excellence. I think that will be critically important for us to have a national presence. We're going to look at our PhD curriculum. We're going to evaluate new degree programs, and we're going to continue to actively grow our endowments and scholarships so that this world-class U of R School of Nursing education is accessible to as many folks as it can be, even if they perhaps can't afford the tuition, that they can get this education. As we move on, strategically, we're also going to focus, next slide, please, in research. Again, we want to increase our funding. We want to increase our NIH rankings. We can spend a lot of time talking about NIH rankings, but bottom line, they help us recruit faculty, staff, and students. So it's critically important we begin to grow there. We are also going to look at strategically those hires that we bring in. They're fit with the Aging Institute at URMC, which is doing international world-class work, health, humanities, and bioethics, as well as the Wilmot Cancer Institute, and really look at how we can accelerate knowledge generation and dissemination in the health sciences. As we move ahead to the next slide, we're also going to continue our focus on diversity, equity, and inclusion. We want to continue receiving the HEAT Award, and also, more importantly, having a culture where students, faculty, and staff feel welcomed. This is their home. This is where they belong. So we're going to continually work on increasing our pipeline of diverse scholars, faculty, and staff. We are really going to begin to work and look at a culture of wellness and what that means, as well as worker resilience programs. So as we move on to the next slide, what I really want to, I felt like I should have a drum roll in the background, is talk a little bit about the UR Scholars Program, which is our academic clinical partnership. We think that this is transformative, not only for the School of Nursing, but for URMC. We are in the final stages. We're ready to maybe sign the ink. We're ready to roll this out. It's a partnership with Strong Memorial and Highland Hospitals, where aspiring nurses will be provided with a tuition-free program in exchange for a 3-year work commitment. It gives that world-class education, back to our diversity and equity and inclusion. Students who may have thought that they could not be at the U of R will be able to get a U of R education and have a guaranteed job on either Strong or Highland. It will be for our 12-month accelerated bachelor's program. Again, 100% of the costs will be covered for a 3-year commitment to work at either Strong or Highland. We're going to also we have in our partnership, there will be much mentoring and networking as part of the academic clinical partnership. This is exciting. We want to spread this far and wide. Anyone who wants this slide to post on a billboard, and wherever we can, we really want to get the word out about this academic clinical partnership. So as we begin to hear more of what's going on, what I would like to do, for many of you, you had the opportunity to see our new vertical expansion. It's an amazing space. Whenever you are here on campus and want to visit that vertical expansion, make sure you reach out to us. But what we're going to do next is we're going to have a little video whenever Colleen is ready to highlight our vertical expansion.
So this new expansion is 3 additional floors on our education wing, 20,000 square feet of state-of-the-art experiential learning. We have significantly increased experiential learning spaces, which means classrooms aren't just classrooms. They're classrooms where students are applying what they're learning. It's really essential that our graduates have opportunities to apply their skills in a psychologically safe environment where they can learn from mistakes, where they can leave their program being ready to enter a very challenging and dynamic clinical practice settings. So wherever they go on to work as nursing educators or as clinical leaders, they're really also learning all of those skills in a state-of-the-art environment that's going to mimic reality for them. So a brand new skills lab that's equipped with all of the same technology and equipment that people would be seeing in a hospital. There's 4 state-of-the-art simulation suites where we can accommodate high-fidelity human patient simulators. We have virtual reality spaces where students can be immersed in the kinds of environments that are sometimes challenging for a student to be in while they're in a clinical. So for example, a mass casualty trauma, or a complicated delivery with a postpartum hemorrhage, or in an operating room. And we use standardized patients that come in, and the students are given multiple opportunities to practice the skills of patient encounters in a very autonomous way without a preceptor, standing over their shoulder. They're allowed to really reflect and learn on that. And it's a great way for us as faculty to assess how the students are attaining those competencies across their program. It really is our goal here at the University of Rochester School of Nursing that our students graduate practice ready and that they are prepared. And we have really empowered them with all of the tools to be able to face the challenges in healthcare today. I would say the most exciting thing about this new space is the opportunities that we have ahead of us to really be a leader, not just in the region, but across the country, in this area of simulation, experiential learning, academic innovation. We're really changing the face of education.
Thank you, Colleen. So now I am very excited and hopefully that video stimulated many questions from all of you, and you can put them in the chat. We have an excellent moderator here who's monitoring the chat. Thank you, Dee Dee. What I would like to do now is transition and talk a little bit more about that space and truly what it means for us as a School of Nursing and what it means for us, for our students. So I would like to turn and have an open discussion with Dr. Rotundo, Dr. Baylor, and Dean, who is our student representative, really the experts using this space on a day-to-day basis. First, I'm going to turn it over to Dr. Rotundo. Thank you, Lydia.
Hi. Well, thank you so much for allowing us the opportunity to talk about something we're really excited about and something that's very exciting. So I think for those of you who know me, I'm a big Simon Sinek fan. And so the whole important thing is starting with the why. And so I really think that what you see in this expansion is really the architectural embodiment of a philosophy of nursing education that was really started probably 5 years ago, when we really looked at, did a examination of, excuse me, the drivers of what 21st century health professions education needed to look like. And so we really wanted to embrace that future perspective and look at the drivers of nursing education and figure how we could respond to that with that future in mind. And so when you look at some of those drivers, many of us are very familiar with them, but just to understand the impacts of an aging population and changing demographics with increasing chronic illness. And we all know the poor health outcomes that we receive despite the significant investment in our country in healthcare. Speaking of healthcare delivery, the complexity of healthcare delivery across the healthcare continuum will require different tools, different skills, different knowledge. And so we wanted to make sure that we were being responsive to that. And then relatedly, looking at the widening health disparities and lack of access to healthcare and the related impact of structural inequity and discrimination, certainly we need to think about how we are approaching that from a much broader view than a patient and nurse or client and nurse encounter. We certainly know of the exponential growth in scientific knowledge, data, and technology. And then one of the major drivers, which I'm sure Erin can really speak to when she has an opportunity to share her comments, is that there has been probably for the past 10 years, a shift nationally in health professions education to competency-based education. And what that means in simple terms is it's not only what a nurse knows, but it's helping us, the nurse, to demonstrate what she or he can do with what they know. And that takes another level of complexity in terms of in teaching and learning, assessment, and most importantly, looking at how people learn and acquire these skills and knowledge over time. So that's going to be really somewhat codified in our new NCLEX exam, which is a national nursing licensure exam. The new format is going to be released. The new test plan is being released in April. And that has changed in such that a good number of the questions will be unfolding case studies, a portion of them in which the nurses will need to be applying. It's focusing on critical thinking and clinical judgment. So all of those those were really pretty impressive and important points of us to think about and reflect on. And so in order to effectively respond to that, we had underwent during our own education strategic plan, looking at best practices in teaching and learning, contemporary higher education evidence. And we've really sort of culminated in a coalescing around 5 attributes of what we think are 21st century nursing education principles that will really underpin and inform all of our work that's from what we do today and hopefully in the years ahead. And just quickly, what those are is the first principle or attribute is the attribute of understanding that we are looking at transformative learning, which transformative learning is not knowledge for its own sake, but knowledge that is mobilized. So sort of an application of knowledge that's contextualized. So of course, within that context, it is competency-based, it is interprofessional, and it really has to be thought about, requires synthesis and analysis, an application of critical reasoning and thinking across multiple domains and in multiple practice contexts. Another piece that's really critically important is that we have to think about, when Erin referred to as graduating practice-ready nurses, we need to think of our education as systems-based, that our students have to understand our graduates, the interactions among the multiple parts of complex adaptive systems. And we have to embrace that both as a process and how we think about education, as well as the product in terms of how we graduate systems thinkers who are able to integrate their clinical and their specialty knowledge and their disciplinary knowledge within the larger context. Of course, for us, we have really embraced technology as the strategic enabler of learning, and not only in terms of how we deploy, how we achieve our teaching and learning practices, but recognizing that nurses are knowledge workers and we live in a digital age and we have to prepare them to be lifelong learners. So having them comfortable in multiple technological environments where they are learning their own skills, but thinking as well about the future and how they can think about technology more broadly is really something that's critical. And I'm sure Erin will talk more about that in terms of the ways in which we do that. And then really thinking about learning environments in a much more pluralistic way. We are reimagining the learning environment, which is really the fundamental principles of our IROC program, redefining our classroom. We want our environments to be learner-centered and experiential. Erin referred to being psychologically safe and inclusive, where environments are places of discovery and knowledge construction, where they're active learning, as opposed to presentation, where students are just passive receptacles, like taking in that information. And that knowledge is attained in a way that there's a breakdown between the barriers of clinical and didactic and classroom rather, and lab. And I think our building really speaks to that exactly, that you really are coming there to learn in multiple environments. And then last but not least, and I should have started with this, but I certainly will end with this, is the most important piece is to really focus on faculty development. We need to have, if we want the graduates that we are talking about, we have to have faculty who not only understand the philosophy, embrace the philosophy, but are able to very creatively take their talents and expertise to bring to that learning environment, and wanting them to shift from what's referred to as the sage on the stage to more of the guide on the side, where they're mentors and coaching and facilitating learning. So these are very exciting principles that we're excited to continue to develop and put into practice. And I certainly welcome any questions after my other speakers get to present, and I will turn it over to Erin.
Great, thank you so much. And I believe Colleen may have a few more slides, because I thought seeing some photos of some of the really new and innovative things that we have gone out of our comfort zone and really helped to develop here as an educational model would be more meaningful than having me just talk about it. So I'll just briefly sort of talk about some of our new initiatives that we're doing here in this new expansion. This physical structure has really opened many doors for us to be able to enable more interprofessional learning, active learning in the classrooms. For those of you that can see behind me, I'm sitting in one of our classrooms here where I have been teaching all morning. And it doesn't look like a traditional classroom, right? You'll see many pictures of this. All of our new classroom areas and learning areas have clinical areas in them. So we've really blurred the lines between what is a lecture, what is a simulation, what is a lab, because we're making everything be very focused on our students acquiring the critical thinking and clinical decision making that they are going to be required to have when they're in their clinical settings and in employment. So I'm going to go through just a few slides to talk about some of the new things that we're doing here at the school. So Colleen, you can go ahead and forward to the next slide. So one of the exciting things that we have become really a leader nationally in here is using standardized competency assessments for our learners. And this is something that we're very thoughtfully building into our programs at regular intervals throughout each semester. Where we can identify students who may benefit from some additional clinical time remediation. So these are called OSCEs. They've been used in medical education for quite some time, but in nursing education, there aren't as many schools that use these. So the objective structured clinical examinations, we just facilitated about 36 of these this morning here at the school, and these were students who were identified as benefiting, who may benefit from some additional help. We've already completed over 300 of these this semester and close to 1,000 since our building opened just this spring. So this has been an exciting initiative in which we're really putting the University of Rochester School of Nursing on the map as a leader in competency-based education and assessments. Go ahead, Colleen. Another exciting new initiative that was sort of mentioned before was virtual reality. And so we are using the software platform developed over in the UK from Oxford Medical Simulation. We chose that software because it allows us to do interprofessional simulations as well as for every level of our undergraduate or pre-licensure students, in addition to our graduate students. So they have a tremendous library of cases that were all developed by medical professionals in which students using an Oculus Quest headset, you can kind of see in one of the pictures there, is able to be immersed in a variety of very dynamic clinical settings where they can practice over and over again how to assess, treat, manage for our provider, for our NP students, how to diagnose and treat and provide patient education to a variety of pediatric, young adult, over adult, geriatric women who are in different phases of childbirth. So this has been an exciting opportunity because, when things get, kind of hectic in the clinical setting and maybe there's a code going on or there's, a trauma situation in the emergency room, our students are probably not front and center in being the decision maker in those situations. So to give them the ability to learn how to critically think and make decisions in these virtual clinical areas has been really exciting. Very new initiative. We're one of the first nursing schools, I believe in the state of New York anyways, who has fully implemented and aligned this throughout our curriculum. So this is a very exciting new initiative for us. So the other area that we are really excited that this physical space has opened up some doors is for us to participate in a variety of interprofessional education initiatives using simulation. So we have a variety of our own students, so intraprofessional, undergraduate, graduate students, learners in our M&E CNL programs, also being able to work collaboratively in both low fidelity lab, virtual reality, and high fidelity types of simulated environments. We also have done a handful in just our, 8 months of being open, but we have many more planned with our partners in practice across the street at URMC, as well as in a few other universities in the region and the School of Medicine and Dentistry. So we're planning quite a few really exciting opportunities, because I think all of us recognize that when we want our graduates to be practice ready, that means being able to work as a team. And so training them in teams is a really valuable way for them to learn the roles of other people on the healthcare team, and work on some of the sort of professional development aspects of that. So that's been a lot of fun. This picture on the left is a group of our graduate students who are practicing doing suturing and wound care, which our new skills lab allows for incredible education as well as practice for students right here in this facility. And you can advance that, Colleen. So as was previously mentioned by Dean Kitko, we did just start a pediatric acute care advanced certificate program this past year, the first one in New York State. And so you see a picture here of some of those students who are engaging in an interprofessional simulation around pediatric trauma. So we were able to have a pediatric simulator with an active hemorrhage and a head bleed who needed incredible amounts of advanced trauma-based care. And so we worked with the trauma team over at the medical center, and this would have normally, historically, been maybe a guest lecture where we invite somebody to come and stand in front of a group of students with a PowerPoint. And what really transformation looks like is for students to receive some of the pearls about curricular-based, whatever the content is for that module in advance. And then when they come to the school, they're really applying what they've learned. And so they went through a variety of unfolding cases where they practiced doing different procedures, and then it culminated with some simulations where they could actually take care of a patient from start to finish. And this was something that our students are just really excited to be participating in so much active learning. And go ahead, Colleen. Another simulation that we have been doing and has been really well received across the university, not just with our own students, as we've transitioned this to also be an interprofessional education, is our community action poverty simulation. So we transform areas here in Helenwood Hall to be a low-income community where the students are actually members of the community who are learning to understand some of the barriers and the resources that exist in low-income communities, and how this really impacts our role as nurses and members of the healthcare team to better understand how we can advocate for patients who are incredibly vulnerable, and for us to understand a little bit from the patient perspective how sometimes getting in for a routine health maintenance or promotion visit isn't always at the top of a patient's priority list when they're really struggling with food insecurity, housing, or unsafe living conditions. So this simulation is offered 1 to 2 times every semester. So this year we'll be doing it 5 times, and we've been inviting other practice partners from around our community to participate, because I think this has a pretty powerful impact on everyone who participates, whether they're a volunteer, as a being in one of the community agencies, or as a participant. So I hope that all of you can have a chance to either observe or participate in one of these events. If interested, just reach out. We've had several alumni who have already reached out and have come and participated, and they are just in complete awe of what this day of learning is. And then very recently, we had some school nurses from the Rush Henrietta School District who, instead of doing a more traditional professional development day, they asked if they could come and spend the day doing simulations here at the school. So our team, we have a team of 17 on our sim team of educators and technicians, and we welcomed them in and had them go through a variety of cases that would very much simulate the kinds of things that they might encounter in the school-based health centers or the school nurse offices in the community. They got to do the virtual reality. They did some interactive things in the skills lab, and they said it was, one of them commented that it was the most profound professional development she's ever had in 30 years as a nurse. So that made us feel really good about that. So those are just a few of the highlights of some of the new and sort of collaborative, innovative, experiential kinds of learning that's being facilitated every day here at the School of Nursing.
Now we would like to hear a student perspective. So Dean, we're going to turn it over to you, and thank you.
Thank you. Hello, everyone. I'm Dean. And just to clarify, that is my name, not my title. And I'm a member of the January 2022 cohort for the Accelerated Bachelor's Program. A bit about my background: I graduated with a degree in biology in 2015, and I spent the next 6 years working in education. So I came here as one of the first cohorts to get to use the new space in our first semester. And I believe we are the first cohort that's been able to use it across all 3 of our semesters, so for our full learning experience. So I've really enjoyed the way that the learning is integrated throughout our classes, our lectures, our labs, our simulations, and even at home. We've been given skills trainers so that we might say, learn a skill at first by watching a video and seeing it demonstrated and learning about it in a lecture, but then coming to lab, getting to practice it hands-on, and getting to be evaluated in a real sort of simulation where we know that patient safety is not at stake. So if we make a mistake, it's going to be okay. You know, we're going to go over it. We're going to learn from that mistake. You know, I like to think of mistakes as an opportunity to learn, but in the hospital across the street, when patient safety is involved, you know, that's not always appropriate. So it's amazing to have this space where you feel like, okay, I know I'm just going to try my best here. We've learned about this. I know a little bit in advance what we're going to be doing. And if I make a mistake, we'll go over it and I'll be able to do better next time. So I really appreciated that. And that's one of the things about the University of Rochester that really attracted me to this program in particular. Additionally, I just wanted to highlight that not only have we had, you know, our sort of regular hospital-based simulations, but we've also had psych simulations. We've had telehealth simulations. We've had home health simulations. And we even had a patient where we followed their story across multiple hospitalizations as we were taking care of that patient. So I think it's really thoughtful how they've created this process. And I've learned personally a lot from it. I know at first I was a little apprehensive about sim. I didn't totally know what to expect. And by the end of the 3rd semester, we were having simulations every week. And I really look forward to them because that's where I feel like we did a lot of our learning and we got to practice not just, you know, do you know this concept, but how do you apply it, as Lydia said. And also, importantly, practicing those clinical judgment skills. That's the most important thing. So I know that has been a point of contention across nursing, you know, making sure that new grads are ready with those clinical judgment skills. And so I think they've really emphasized that throughout our program. How do you make sure that your clinical judgment skills are where they need to be so that you're safe as a new grad? And I look forward to hearing your questions. So thank you.
Thank you, Dean. So as we look, Dee Dee, we can turn this over to you for questions. Please ask your questions, put them in the chat, whatever you feel most comfortable with. Thank you, Dee Dee.
Right, I already have a few. So we'd like to open our discussion to our audience, and I invite you to unmute yourself to ask your question, or feel free to type it into the chat and I'll direct it to the appropriate panelist. Does anybody have any? Because I do have a couple in the chat already, but if anybody wants to pipe up right now. All right. So from Jerry Lamb, she says, fantastic update. if there is time for questions, which there are, I'd love to hear an example of or two of how the principles discussed by Dr. Rotundo, especially in the area of systems awareness and leadership, example, value-informed care, policy payment, are translated into SIM and student experiences.
So Erin, I don't know if you want to give an example from simulation. I can give another example that we use in the DMP program, but if you want to just talk about that.
If you want to start, then I can.
Okay, think about, okay.
Yeah.
Okay. So one of the things that we do, it's not necessarily a simulation per se using this space, but for example, in the DMP program, we talk about systems thinking. We have lectures on systems thinking. We encourage the students. This is a good example of the learning the information and then applying it. So they'll learn all about systems thinking. What is it in terms of practices? How is it used in healthcare? And then they have an exercise where they employ. There's 14 habits of systems thinkers, and what they do is they take those habits and they apply them to a scenario where they're doing a pragmatic clinical trial, or they're doing a community-based research project where they're going to now take that protocol and bring it into a community in Monroe County. And now they have to think about all the dimensions of what's involved with that, from reviewing the literature to designing the plan and the methods, the evaluation, the implementation, all of that, and using habits of a systems thinker. They do that as individuals. Which habits do you think you really need to be thinking in terms of thinking the interconnection of pieces, thinking of unintended consequences? There's a really terrific resource from the Waters Foundation. And then we talk about it in class, and then they bring together in groups and they look through it. And then we do all kinds of, well, what are the habits that we really don't really think about? What would have been better utilized in this? How do we complement each other with the point of view from others' perspectives that may have that as that particular example as a strength? So that's a very specific, concrete example of where systems thinking is the goal. However, you cannot be in a pediatric trauma resuscitation and not be thinking as a systems thinker in terms of the complex interaction among the roles, what's happening pathophysiologically, certainly in terms of the systems and interdependent elements of an institution. So that would be more of a clinical application of this kind of thinking. So Erin, I'll see if you have anything you wanted to add. Okay.
Yeah, and I know I already talked a bit about the poverty simulation, but a lot of what is discussed as part of the debrief for that is areas around policies that exist, or policies that maybe could be relooked at to be able to think about what barriers exist for patients who are trying to access healthcare. And so we talk about everything from like prescription coverage to, access for transportation to healthcare, settings and things like that. We've also taken some concepts around ethics and public policy that we have built very thoughtfully into a variety of simulations, where students have to really think about utilization of healthcare and what patients should be managed in an outpatient setting versus being sent to the hospital. We get into some complicated issues about what is the nurse's role in discharging patients that that we anticipate may not be able to be successful in the community, home setting, and how can we learn to advocate for resources and policy change. So those are a few examples.
That's a great example, Erin, the poverty sim.
All right, from Barb, Dean, what kind of support will you get when you start at the Children's Hospital?
Yeah, that's a good question, one that I'm glad I have an answer to. So in addition to the fact that, of course, we have our 3 months of orientation, they do onboard all groups of new nurses, and we have meetings that we attend just to help give us the support that we're going to need as new grads. We have a mentorship program, so I'll be working with someone in addition to my preceptor, who's just going to be acting more as like a mentor who I can go to with any questions that I have about anything. And I'm also happy to state that I know that my personal clinical instructor, when I was there for my clinical, because I'll actually be working on the unit that I had for my pediatric clinical rotation, she is the nurse educator there. So she's also going to be another great resource for me, because it will be a challenge, of course, when I'm starting in my new career. So I hope that answers your question.
We have some other questions in the chat. Oh, we had Can you discuss more about the academic partnerships and collaboration with NP residencies within the U of R Medicine Network? Lydia, probably, Dr. O'Connor, probably.
Sure, I'll check that. So our relationship with our clinical partners is really one of the, it's a bedrock, it's part of the bedrock of excellence that makes it so rewarding to work here. And for many of you who are graduates, you know that firsthand and can continue to connect with the Rochester, with the school through their practice partnerships. So when we talk about fellowships, nurse practitioner education, postgraduate education there's called residencies and fellowships. They're kind of used interchangeably and they're a little confusing. So let me give you two discrete examples. So Highland Family Medicine has a primary care nurse practitioner residency. So the students finish, the graduates, and then they have a year of residency. They've also extended it through another HRSA that was a HRSA grant, HRSA extension for rural practice. The School of Nursing was part of that HRSA application from the beginning. One of our faculty not only wrote part of it in terms of the working, having the collaborative partner be the UR School of Nursing, but also was the first director of that program. And we have continued to continue that strong collaboration. For example, Dr. Limasara, who is the individual I was talking about right now, meets monthly with the residents. She's no longer their clinical director, or program director, but she works monthly with the residents to just continue to mentor them and to talk with them. And that program was recently nationally accredited, and the School of Nursing was very much a part of that experience. If we look at within the medical center proper, more and more nurse practitioner programs, there might be 10 of them now, there was 8 or 9, are hiring nurse practitioners, and then they're going into year fellowships or residency programs. Dermatology is 2 years. And these are postgraduate training where the nurses get, again, more, they have didactic education, they have, of course, clinical education. In the one that Ann Swans, who was the previous director of the SOBI Center, they have a program with a primary care, which the School of Nursing was part of building that program in terms of structuring it. But in these programs, the School of Nursing has really worked collaboratively with, first of all, our graduates, and also working with the director of the SOBI Center. In fact, the current director of the SOBI Center, Cheryl Lustig, when Dr. Lustig was in her DNP program, her DNP scholarly work was centered around creating an evaluation tool to systematically evaluate all the programs. She used 3 as her pilot to look at effectiveness in terms of the outcomes of the students' learning, the relationship with the preceptor, the effectiveness of the impact of having the residency on outcomes of patient care. So it's, as you can see from those 3 examples, we are very, very well, integrated and connected.
A few more questions. How many simulations will each APNN, the Accelerated Bachelor's Program student, experience in their 1-year program? Dr. Baylor?
Yeah, Dee Dee, you might have to help me do some quick math, but I am adding these up in my head right now, and I am coming up with a number of between 35 and 40 simulations that they will undergo. And it sounds like a lot, but we are doing simulation during classes. We're doing simulation if, as many of you know, the clinical units are sometimes a little bit less busy for students later in the afternoons after they've done many of their things early in the day. And so they'll come over after clinical, and instead of doing a traditional post-conference, their clinical might be focused around a concept that they're going to be tested on the following week. So they run through a few cardiac simulations, for example. So we're using it to augment the classroom content. We're using it to reinforce lab content. We're using it to prepare students for their clinical rotations. So we do some that are very strategically placed at the very beginning of a rotation so that students can gain competency and some confidence before going into, say, psych mental health. So they learn, they currently undergo simulation pretty much every week in all of their specialty courses. So yeah, so it's, and it just keeps growing, because the more the students do, the more they want, and we're all seeing the benefits of having these kind of thoughtfully scaffolded learning opportunities for them.
And a kind of a piggyback question to that is, how often do students get a chance to interact with standardized patients?
So it probably depends on the program. I would say in our accelerated program for our pre-licensure students, they have, I think it's approximately about 8 or 9 of their simulations involve a standardized patient. In our nurse practitioner, M&E, and CNL programs, they work a lot with standardized patients. So at least 2 times every semester. We do a midterm and then a final. Instead of this being a paper and pencil exam, it's assessing their competencies. So they're coming in and working with standardized patients pretty regularly.
Dr. Maddie Schmidt put a question in the chat, extending the question about systems thinking. Do students get an opportunity to explore healthcare as an endpoint of bad policies, like seeing children with serious mental health issues that result from parent-child separation at the U.S. border? That is, immigration policies versus centering the system of healthcare and what prevents folks from using it.
I'll take a stab at that, although I love Maddie Schmidt questions because they're always so probing, and we could probably spend 15 minutes just answering this. Maddie, to your point, it is a critical element, and the answer is we have to continue to build those connections. I will just say, of course, as you know, in the DNP program, every course, every project has a policy dimension. There's a policy course, but more importantly, this idea of and the consequences, downstream consequences of all our work that you're speaking to, what's so important. Erin, in your role as a pediatric nurse practitioner, I mean, that was a really elegant example about the poverty sim. That poverty simulation is all about societal impact. And it really comes out, those aha moments in the debriefings, if you see the students respond to that. But as the PNP program director, where you do have a lot of clinical education across the multiple settings, can you speak to anything from your example as a program director?
Yeah, so we actually have just run through 2 simulations in the past week for our pediatric NP students that focus around behavioral mental health. So we address issues that we know are high priority, like suicide assessment and screening, and how nurse practitioners can and should be working with school districts, parents, both community providers, mental health professionals, to be able to do a better job from a system standpoint with screening, advocacy, collaboration. So that is one example. Another example that kind of made me think about this is we have very strategically, this isn't an accident, this was built by design, is make sure that every simulation that we do has a component of social determinants of health built into it. So we don't ever just design a sim without taking the opportunity to help students build their skills around assessing things like health literacy and equity and all of the different determinants that we know can have an impact or be a protective resource, for patients. So that is built in. So in another one of our pediatric scenarios, it is a child who is here illegally, and the child has had emergency surgery for an appendectomy, and the parent does not speak English. And so there are some logistics that the students have to explore around discharging the patient, getting medications filled without insurance, providing patient education to a family member who doesn't speak English. So the students have really enjoyed working through in getting a better understanding. We see this as just one small piece of getting them prepared for what real clinical practice is going to be like.
Yes. And as I wrap up, Maddie, excellent question. And to your point, I think this extends beyond our students in the School of Nursing. As faculty, we are engaged with community partnerships, community engagement. I see many of our new amazing research faculty on the call that are looking at social determinants of health, looking at policies for stigmatized populations. So I think that every mission within the School of Nursing, I can say, is really addressing your question from a policy, a research, and a systems perspective. So thank you for that great question. And I think that that's a great question to wrap up and transition, beyond education, all of the great things that we have going on here in the School of Nursing. I hope if we have the opportunity to do another conversation with the dean, that we're able to focus on some of those other aspects of the school as well and highlight the great work that's being done. Before I turn it over to Dee Dee, thank you, Dean, Aaron, Dr. Rotundo, for sharing your expertise. I can tell you that passion that you see from everyone on the screen in the video or in their conversation, it's part of just how they daily do their work here. So it's amazing. Thanks to each of you for attending. And Dee Dee, I'm going to turn it over to you.
Thank you. A very special thank you to Dean Lisa Kitko and our panelists and all of you who attended today. A recording of today's conversation will be shared with registrants in the next few days. In the meantime, we've listed 4 key ways alumni can continue to engage. Consider attending future virtual and in-person events. Make a gift to scholarships, research funds, or Hollywood Hall. Consider volunteering on your reunion committee or serve as a mentor. Join us on the Meliora Collective and in the School of Nursing group on the Collective. Again, thank you for joining us and have a wonderful rest of the day.